Welcome to NU 623 Adult Healthcare Unit 3 Presentation 3 on tuberculosis. Please read the chapters in your book so that you can understand the depth of the information. This presentation is only going to give you some highlights. Pulmonary tuberculosis is usually going to present with patients having fatigue and lack of stamina, fever and chills, a productive cough, which can be greater than 3 weeks in duration, pleural pain, which is usually going to be unilateral with cough or with deep inspiration, with hemoptysis and purulent sputum, coryza, hoarseness, loss of appetite, weight loss, and night sweats. This is an insidious onset in this form. Extrapulmonary TB, the symptoms are going to depend on the part of the body that's affected, so please see the box inside your text on page 387 for those. Latent TB is going to be asymptomatic, but it can progress to active TB, so it's important it's identified and treated. In your physical exam, adventitious breath sounds can be crackles, wheezing, rhonchi, or bronchial sounds for pulmonary TB. Initial testing for tuberculosis can be done with the Mantoux tuberculin skin test, or more commonly known as the PPD, or the interferon gamma release assay, which is a laboratory value. Neither of these tests will distinguish active from latent disease, and the skin test will actually show positive for anybody who has had a previous vaccine with BCG, which is usually given in other countries. The interferon gamma release assay won't cause a false positive in those who have had the vaccine. Interpreting the skin test is very important that you understand how to do this. You measure the palpable area of induration, not the redness at the site. Please see box 30.2 in your text for interpretation and see box 30.4 for reasons for a decreased skin response. If the above tests are positive, then you're going to obtain a chest x-ray. If the chest x-ray is negative and there's no signs of active disease, then you can diagnose latent TB. If the chest x-ray is positive, which means there would be some airway opacities or cavities or pleural effusions, you're going to want to get sputum for acid-fast bacilli smears and sputum cultures. You need 3 specimens 8 hours apart, looking for the mycobacteria to confirm the diagnosis. If you cannot get a result or the sputum cannot be obtained, a bronchoscopy sampling can be done, and there's also a nucleic acid amplification test, which is a rapid diagnosis and has less than 8-hour turnaround. Make sure you understand the differential diagnosis for TB and you understand how to work each of these up. The treatment goal is to be curative, but also to prevent transmission to others. You have 2 different regimens that you can do, and it depends on if you have an active or a latent finding. Prior to doing any treatment, you're going to want to do some baseline labs, at least a CBC and a CMP. If there's going to be treatment with ethambutol, you're going to want to do a visual acuity test and a red-green color perception test. If there's going to be treatment with pyrazinamide, then you're going to want to do a uric acid test. For active TB, we use multi-drug therapy because there is a lot of resistance. So the 4 drugs listed here would be done initially for 2 months, and then the remainder of the treatment, the 4 months, will be INH and RIF. Now, it's a total of 6 months of treatments, and you're going to treat the symptoms as well. If there's excessive coughing, you can use codeine or hydrocodone for the cough unless there is very thick secretions. There are exceptions to the treatment regimens. You're going to want to look in your text for the treatment considerations and the adverse reactions for each medication. Additionally, you can treat symptomatically with expectorants and antipyretics for fever, and you're going to want to do a lot of education with your patient for bed rest for high fever and excessive coughing. Make sure they understand a fever can last 2 to 3 weeks. They're going to need a lot of hydration and humidification to help with secretions. You want to teach them about transmission and isolation. They really should be staying home. If they're going to be going out in public or they're going to have visitors over, they need to wear a surgical mask. And adherence to medications is a huge thing because of the length of treatment, and you want to make sure they understand that they have to treat it fully for the full course to eradicate it and to also prevent antimicrobial resistance. For latent treatment, you are going to want to treat those even though they don't have active disease and they're not transmissible. They could become transmissible at any time. So there are two different options. You can do monotherapy with INH or RIF at the time frames suggested, or you can do a combination therapy with INH and rifampicin. That is basically just a little bit longer acting type of a rifampin, and you can do that for 3 months. Follow-up will be based on the severity of the disease and the type of medications that you use due to monitoring for drug toxicity. You're going to do periodic exams, weight, signs and symptoms, temperature, visual acuity, and eighth cranial nerve testing, monitor for adherence to the medication and disease or medication complications. Periodic labs should be done. The acid-fast bacilli smear should be done weekly or biweekly to monitor progress. You're going to monitor labs for drug toxicity based on the different drug profiles. At the end of treatment, you're going to want to see 2 normal sputum cultures to confirm cure and a chest x-ray. For referral, understand that you're usually going to make a referral to the health department because there's mandatory reporting for all active TB cases, either suspected or confirmed within 24 hours. Latent TB infection is not reportable in all states, so understand what your state requirements are. A lot of times the health department gets involved because they have to ensure treatment adherence. Complications such as shortness of breath should be sent to the hospital because this can signify acute pleurisy effusions or a spontaneous pneumothorax. Or if compliance is an issue, a patient may have to be hospitalized and not be allowed to stay in their home. Ensure that you do thoroughly read the chapter so you can get more information on this subject, and look at your course module for any resources.